So with cases on the rise, where are we in the battle against COVID?
Yeah, I think we're probably in a slightly new phase, Rona. You've seen us over the last 7 to 10 days just get a little bit nervous and worried about moving from really quite low numbers and not huge numbers, not exponential rising, but 150, 200, 200, 170. We've had 1,000 cases in a week. We're beginning to see some admissions to hospital, so we're worried. We genuinely are. It's not a second wave. It's not out of control. It's not April, but we have to be so careful.
The First Minister is making a statement tomorrow on the latest review of the lockdown. Can we take it that we won't be moving into phase 4 when we are seeing this increase in cases?
I think you can take it for sure. Her and I and Gregor this week at the briefings have said we don't expect major change tomorrow, and that doesn't come as a surprise to anybody. I'm not going to give you a preview of what she might say, but we are in a difficult phase, and that phase requires two things. It requires our test and protect system to be absolutely pristine and working really hard, and it requires the population to behave actually as they've done really well over the last few months to really stop those chains of transmission. But I think you can expect not huge changes tomorrow.
Well, I mean, rather than easing restrictions, might we see more restrictions in coming weeks?
So that's always been a possibility. You've seen us in, really unfortunately, nearly 1 million people, including me, in 5 local authorities around Glasgow City and 4 neighbouring local authorities, having to have fairly severe restrictions on their ability to have people in their houses or them to go to other houses. And if you're a contact of a positive case, your whole household being self-isolated, that's a big step. We may have to do that other places. We keep that data under constant review. We hope that those restrictions will help limit the spread and we'll be able to remove them on these 5 local authorities. But it's too early to say. We're 7 or 8 days into those restrictions, too early.
Prime Minister Boris Johnson confirmed today that a maximum 6-person rule will apply to indoor and outdoor social gatherings in England. I mean, would that make sense in Scotland? Do you think that we might come to that at some point?
So we're looking at the detail of what they announced today. It wasn't entirely clear to me about number of households versus number of people. We've always been kind of balanced. What you're trying to prevent here is the number of times the virus can jump from household to household. It's pretty hard to avoid it if somebody brings it into your house and you live with that person and you're not distanced. But it is easier to avoid if you don't create the bridges. So 6 people from 2 households, 6 people from 6 households, they're very different things. So we need to look at exactly what they're doing and the exemptions. So places of worship, weddings, funerals, sports, and we'll make our own judgments. The advisors will make some judgments, and then the decision makers will make some judgments about exactly what that might mean for Scotland if we did that, something similar, something different.
I mean, we're talking there about what's happening down in England, but some people are saying that it's confusing that we're getting different messages from different parts of the UK. Should we have a more united UK approach? Might that be more straightforward for people to understand?
So I preferred March, if I'm honest. March was easy for the public health advice. You could just go on the TV on your show and tell everybody to stay at home. It's much more complicated, whether it's quarantine from overseas or schools opening or face cover. Of course, it's more complicated. I think the 4-country differences are maybe a little overstated. Most people know where they live. Most people know which regulations and guidance apply to them. Of course, the messaging should be as clear as we can make it. And that's why you see the First Minister, the Cabinet Secretary, me, Gregor, out on the airwaves, perhaps too much for some people to listen to, but trying to get those messages across. I agree with you that we should be as simple as we can. We should, of course, combine across the 4 countries when that's possible, but we have different contexts. We have island communities, we have more rural communities, we have different demographics. So we've got to make Scottish judgments, but try and do that together if we can.
We are starting to see this rise in the number of cases, but still very few deaths and not that many people being admitted to hospital. Why is that? And also, do you think that we might see a spike in deaths in a few weeks' time?
Yeah, so there's two great questions. The first thing to say, unfortunately, is that there's no science to suggest the virus has changed. So the virus mutates a little and it evolves a little bit, but it hasn't changed to be a non-deadly virus. That might happen, and we hold out great hope that it will, but not so far. So it's the same virus we had in March and April, and it's the same virus that caused almost a doubling of Scotland's excess death rate in April. So we've got to be careful. The people who are getting infected with it now, as opposed to March and April, tend to be under 40. It's not universally true, but roughly speaking, the majority of them are under 40. And they get a milder disease. Some of them get very sick, but very, very few of them get hospital admitted or intensive care or die. What we worry about, of course, is incubation period, 2 weeks, up to 10 to 14 days. And 2 incubation periods gets you to giving it to your granny or giving it to your uncle or your aunt, and they may be vulnerable. So we do fear, and that's why you see us doing stuff now, we do fear that transmission could carry on into the older, more vulnerable age group.
20% of people who have been told to self-isolate are not, according to figures. Does that not really concern you? Does that not undermine everything that you're trying to do?
It's one of the most important elements of the fight against COVID, no question. And it's the S of our FACTS acronym that we've tried to teach everybody. If you have symptoms, you have to test and self-isolate. And we want that to be as easy as it can be. It's not my job to get the financial support for people who are self-isolating, but the public health advice is you shouldn't be penalised for self-isolating, whether that's economically or your job or your education. So we should try as a society to make that as easy as possible. I do worry when I see some polling numbers that suggest not everybody is quarantining after an overseas trip, or not everybody is self-isolating because they're a contact and they feel well. One of the most crucial tools in this fight is to get the positive cases and their contacts off the street for 14 days.